Good afternoon, Year 2, and welcome to Tuesday's science lesson. The last few weeks, we've been looking at staying safe and staying healthy, and we looked at the importance of exercise, we looked at the importance of eating a balanced meal, and we looked at the importance of keeping ourselves clean. I wonder how your bread experiments are getting on at home. We did ours in class and we're watching them grow and watching what happens. So I'll keep you updated with those as things change. Hopefully, we'll all be in to be able to see them anyway. So today we're going to be doing the last on our topic on human lifestyles and keeping healthy by looking at medicines. Now, another name for medicines is drugs, and you might have heard that word before. And often the word drugs is used to describe bad or not very healthy types of medicine. But drugs are any type of medicine. So if you've ever been into town, a shop that sells lots of medicine is called Superdrug, and that sells good medicines, doesn't it? So the word drug doesn't always mean bad medicine, but it often is used that way. So we're going to learn how to keep ourselves safe. We're going to know that medicines are a type of drug. We're going to know that medicine should be given to me by an adult, that medicines are labeled with instructions, and that medicines need to be used and stored safely. So what are drugs? What do you think drugs are? Well, drugs. So let's have a think of the questions. Do we know what drugs are? What are they? So drugs are anything that makes a change in your body, really. Anything you take that changes something about the way your body works. It might be for a good way, it might be for a bad way. Okay, so the example, this bottle here on the picture is an indigestion relief. So if your stomach is feeling all bubbly and burny, you would take some of this medicine and it would make that feel better. So it would change the way your body works. Are all drugs illegal? They're not. Some are, but some aren't. It depends what they do to your body. Okay. And have you ever had to take any drugs? Any at all? Yeah? So all medicines are drugs because drugs are just substances that change your body. They have an effect on your body. Okay? So medicine are legal drugs. That means we're allowed to have them. We wouldn't get in trouble by the police for having them. Okay? Medicines can help us to feel better when we are not well. So if you're feeling poorly, you quite often have a medicine. It might be some Calpol, it might be some antibiotics, it might be something that you need, it might be an inhaler if you have asthma. However, if they're not taken properly, medicines can end up making us feel worse. So you need to take medicines properly and how you're told to take them, don't you? So when do I need medicine? Can you think of a time that you might need medicine? Can you think of anything that we might need medicine for? Have a think. So we might need medicine when we have a cough, when we have a sore throat. We might need medicine if we have a sore ear or a sore tummy. We might need medicine for a cold or for a headache or if we feel a bit sweaty and a bit fevery. We might need medicine for a pain in our legs. So medicine helps us in lots and lots of different ways. So regular medicine, most of the time, if we need medicine, we take it for a short while until our symptoms, the things that are wrong with us, have gone and we feel better. So if you had a cough, you wouldn't keep taking your medicine after your cough had gone away, would you? You'd have it until the cough was gone. However, some children and adults need to take medicine every day. Okay, and they can't stop. They have to take it to keep their bodies working, and if they don't take it, their bodies start to get poorly. And can you think of anyone you know who might need regular daily medicine? Can you think of anyone or any illnesses that people might need medicine for? So if you're somebody who has asthma, As in this picture, you might need an inhaler. And an inhaler is a type of medicine that you breathe in, and it helps your lungs to work properly so that you can take in enough air you need to breathe properly. You might know someone who has diabetes, and they might have to take something called insulin, and often they have to inject that into their arms themselves with a needle, and that helps them to keep their bodies working. Some people might be having treatment for illnesses and need medicine to keep that away. So lots of people take regular medicine, okay? But you shouldn't take medicine unless a doctor has given it to you to take, and you should always ask your mum and dad. So how can we identify medicine? How do we know what's medicine and what isn't? Medicine will always be clearly labeled. So it will have a label on it. So this medicine, what's that for? What's the label on it? It's cough mixture, isn't it? Cough medicine. Medicine can come in a liquid. So it might be a liquid like a syrup or a very thin watery liquid, or it might be as a tablet that you swallow. The packaging is plain, okay? So it's quite a boring packaging. You can see this bottle here. There's not lots of colors and exciting things all over it. It's just very simple, isn't it? And it usually, not always, but often shows a picture of what's inside or what part of the body it can help. So what picture does it show on this medicine that lets us know what part of the body it helps? It shows a ring around the chest, doesn't it? So it helps with people coughing in their breathing. And instructions for how the medicine should be stored and given will always be on the packet, and more information will be inside the box that the packet comes in, normally on a piece of paper. So if you see something that looks like this, you'll know it's medicine. Also, quite often with medicine, they have a special lid on them to stop younger children from being able to open them, because they can be quite dangerous, can't they? So you can see on that it's got that special lid, and if you tried to turn it, it would just click, and there's a special way to open it. Okay, they will always tell you what they're for. Who should give you medicine? Who do you think should be giving us medicine? Can you think of anyone? Who gives you medicine at home? Let's have a look. So it usually starts from a doctor or a nurse. Okay, so a doctor prescribes medicine, and what that means is they see you and you tell them what's wrong with you, and then they'll do some checks. And if they think you need some medicine, what they'll do is they'll write it down on a piece of paper, which is called a prescription, and then they will give you the medicine you need. And so they might say to you, you need to take these for a week. So they'll give you enough to take for a week. And then after that, they won't let you take any more. You might need to go back and see them and check how you're getting on. But often that's enough, isn't it? So a doctor is always a person you can trust to give you medicine. Your mum and dad. So your mum and dad know you, and you can trust them, can't you? If you've got something wrong, then they can get you some medicine. Because sometimes things like Calpol aren't given by doctors. That's something mums and dads can buy to give to you to help you to feel better if you've got a little something wrong with you, like a headache or a bit of a fever. And grown-ups do that as well. Grown-ups take something called paracetamol, which are little tablets. When they've got a headache, you might have seen me have these at sometimes. They take that paracetamol and it helps their headache to feel better. It stops the pain from being as strong. But for children, they often give liquid medicines because it's easier for children to have. Your grandparents. So your grandparents can give you medicine, can't they? Mums and dads might tell them what medicines you need to have, or grandparents might decide themselves what medicines you need. A nurse. So if you're in hospital, a nurse might very easily give you medicine. And a grown-up that you trust. So for example, I or Mrs. Bodell or Mrs. Gibbons might give you some medicine, but we would only give you medicine if your mum and dad had told us to. We wouldn't give you any medicine without them telling us to do. Even if you were to fall down in the playground and hurt yourself, we might give you a plaster. We'd clean up the wound. We'd make sure everything was all right. We'd give you an ice pack if you needed it, but we would never give you medicine unless mum or dad or someone who cares for you, like grandma or granddad, had spoken to us and said, can you give my child this medicine? So a grown-up you trust. It might be an older brother or sister, so probably an adult brother or sister. So if you've got someone in your house who's 18 or over, then they might be able to give you medicine that your mum or dad has asked them to give. Would you take medicine from a stranger in the street? Why not? That's right, because you don't know them. You don't know what's in that medicine. You don't know what they're giving you. So we don't always know what people are thinking. These might be people who give us something that might harm us. So it's important that we don't take anything and eat anything off strangers. That's why mums and dads often tell us, don't eat sweets that are given to you by a stranger. Okay, so if someone gives you something without your mum and dad around, always show them to your mum and dad or a teacher or another adult first to check that everything is okay. Okay, if a teacher at school that you trust wants to give you a packet of sweets because you've worked really hard, that's okay, isn't it? You can trust them. But if it was a stranger who you didn't know, then you wouldn't. So where do we keep medicine? Where should we keep it? Where do you think we should keep it? And why do you think that? Very interesting. So where does your family keep your medicine at home? We keep ours in a special cupboard above the toilet. It's our medicine cabinet. And it hasn't got a lock on because we don't have any children at home. But when I have children, I would get a lock for my medicine cabinet to keep it safe. Okay. So can you think of a safe place to store medicine? Now, at school, if we're giving medicine, it goes to Mrs. Wilson and she keeps it in a special locked room in her office so that she knows no one can get it and have medicine that they don't need that could make them poorly. So medicine should always be quite high up and out of sight and reach. So you probably, would it be a good idea to put a medicine for a headache in your biscuit cupboard? No, it wouldn't, would it? Because if you put medicine in there, it could make you poorly, couldn't it? If you think it's a sweet or something, you might eat it. So medicine's normally quite high up, so little children can't reach it. And it's normally, it might be in a locked cupboard or it might be in a hidden cupboard. It might be kept away from you just to keep you safe. Okay, so it's really important to keep medicine safe. And if you have any younger brothers or sisters and you see them trying to get near any of the medicine, it's important that you tell them not to, and then you tell your parents right away. So in this medicine cabinet, you can see there's quite a lot in there. And if we look at all the boxes, the packaging, are any of them really, really, really colourful and like sweet packets? They're not really, are they? They're quite plain. Some of them got a bit of colour on them. There's something at the bottom there that's got a picture of a cherry on it. And there's some purple things, but most of them are quite plain. What medicines can you see in that cupboard? What things can you see that help us? Well, on the top shelf, there's plasters. We use those when we cut ourselves, don't we? There's antiseptic cream. So that's what you put on cuts to stop them getting infected. There's paracetamol that normally grown-ups take if they've got pains. It helps get rid of their pain. There's nasal spray, which you might squirt up your nose if you've got allergies. And eye drops. Again, grown-ups might drop them in their eyes if they've got allergies. On the bottom shelf, we've got something, a big brown bottle, cough mixture for if you've got a cough. Cold and flu reliefs for the symptoms if you've got cold. So if you've got a fever or you've got a runny nose or a headache. Indigestion relief, that's for if you get heartburn, so your tummy starts to feel all burny and painful. There's the packet with the cherries on it is what we call throat lozenges. And they're what we call like throat sweets. They're not sweets in the way that you normally would. So you wouldn't eat them like sweets. You have one and you suck it, and what it does is it helps to soothe your throat. So you'd only take those if they were given to you by an adult, wouldn't you? And above them is an antihistamine tablet. An antihistamine is a word, a very posh word that means it stops it stops allergies from happening. So if you get itchy skin or you are allergic to peanuts or you get hay fever, you'd take one of these tablets and it would help to stop those symptoms. Okay, so they are all types of medicine, and they're all medicines that need to be kept safe because they can be dangerous. Plasters, you might not think plasters are dangerous, but some people can be allergic to plasters, and the sticky glue that sticks them down can make them get quite poorly. I'm allergic to plasters. If I put plaster on my finger swells up and goes really red and sore. So I have to use special hypoallergenic plasters. That means that they don't make me go allergic to them. Things like paracetamols, people, if they have too many paracetamols, then it can really damage their body. It can make their liver and their kidneys not work properly, and they might need to go to hospital. So paracetamols need to be kept safe. Cough mixtures and things like that, if you have too much of them, can make you poorly. So all these medicines, even the throat sweets, can be dangerous if you don't use them properly. So that's why an adult always needs to give them to you. They can help us if we want, for the right reasons, but if we take them for the wrong reasons, then they'll make us very poorly. So what should we do if, here's a couple of situations. We wake up with a sore throat and we know where the medicine's kept. So you wake up in the night, you've got a sore throat, you don't want to bother your mum and dad, and you know where the medicine's kept. Would you sneak down, take some what you think is medicine, and have it yourself? No. Why not? Well, you don't know what it is. You might get the wrong thing by accident. And also, if your mum and dad are asleep and you have something that's not right for you, and then you go back to bed and you get really poorly, they might not know until the morning. So what would you do instead? Would you tell your mum and dad? That's the best thing to do, isn't it? Go to your mum and dad's room and say, Mum, Dad, I've got a sore throat. Is there anything I can have to make me feel better? And then your mum and dad can get the medicine for you, can't they? You wouldn't get it yourself, would you? What would you do if mum forgets to put the cough syrup away and you see it sitting out in the kitchen? What would you do? Well, there might be a few things you could do. Would you drink out of it? Would you open it and drink out of it? Definitely not. It can be very dangerous, can't it, if you do that? Would you put it away in the cupboard? You might do. But what might be the best thing to do is to tell mum that it was left out and let mum put it away. And then she knows it's safe and knows where it is. What would you do if you're in the park and you found a packet on the ground with no label on it that looked like it had small sweets inside? Remember what we said about the difference? Sweets are normally brightly coloured packets, aren't they? But some tablets can look like sweets, can't they? Would you eat them? Definitely not. You don't know what that medicine is, and that medicine, if it was medicine and you had it, could make you very poorly. Also, anything that's lying on the ground that you don't know can be dirty, can't it? So even if it wasn't medicine, you wouldn't want to eat sweets off the ground. That would be very dirty. What would you do instead? That's right. Pick them up and take them and show them to your mum and dad. Do not eat them. Don't put them anywhere near your mouth. Show them to your mum and dad, and your mum and dad might decide to put them in the bin. Because if you leave them on the ground, what might happen is another child might find them and they might not be as sensible as you and they might end up putting them in their mouths and getting really poorly. What would you do if someone took too much medicine? So what would you do? That's right. It'd be really important to tell someone, wouldn't it? Tell an adult if it's a brother or sister or a cousin or someone like that. What happens if it was the grown up that looks after you? That's right. You would phone for an ambulance, wouldn't you, straight away if someone took too much medicine? If you were sure that they'd taken too much and there was no one else in the house to tell, you could phone for an ambulance. And remember that number to phone an ambulance. You'd only do it in a special occasion. So talk to your mum and dad about that. Okay. So I want you to write down or say out loud 3 golden rules for keeping safe around medicine. What do you think are the 3 most important things? Okay. And then after you've done that, your task for today is you've got a worksheet and it's got some questions on it that you need to answer about medicine. You need to draw some types of medicine and write some sentences. Okay. There's 2 sides to that sheet. And if you finish that and you want a little bit of extra work, there is also a medicine sorting sheet. You need to print it out, cut out the things that are medicine and things that aren't, and put them in the right place. Thanks for listening, year 2. Bye.